All hospitals in the United States screen for hearing loss. These simple, very relatively quick screening tests are done in the nursery, usually before the babies are discharged home. We have two methods to test newborn hearing. One is called otoacoustic emissions and the other is auditory brainstem response. The OAE, or otoacoustic emission, we put a small ear probe in the baby's ear canal and then play a sound and the ear sends back an echo. That test in a sleeping infant can take less than a minute. And we test each ear. It's important to know how hearing is in both ears. So if the baby passes that test, we wouldn't necessarily recommend another test unless there were certain what we call risk factors for developing hearing loss later in life.
This next test we're going to do is the auditory brainstem response test.
For the ABR, we actually put little electrodes on the head, usually one on the forehead and one behind each ear. And then again, we play a sound to the ear and we can measure the response, and we're measuring the response from these little electrodes. Both newborn hearing screening tests are completely painless. They're very safe to do on newborns. They are relatively reliable, but they are a screening test. If the baby doesn't pass the newborn screening, regardless of which method is used, we will want to do a more complete test.